The Health Minister has responded to the mother of a 23-year-old man who died after failing to get treatment for his addiction to synthetic drugs by saying he agrees with her. Addiction services are underfunded and more treatment facilities are urgently needed. David Clark was responding to Natasha Sadler, whose son Memphis had been diagnosed with schizophrenia and who became addicted to synthetics as he tried to deal with the increasing terror of his psychotic episodes. The Minister has joined a long, loud chorus of people working in the field of drug and alcohol addiction, from clinicians to treatment centres to the Drug Foundation, who say they simply don't have the resources to cope. Natasha Sadler says she and Memphis witnessed that to his terrible cost.
And he said, I need help. And what was the reply to both he and I? There aren't any beds.
That's Natasha Sadler on Checkpoint last week. Memphis died 3 weeks ago. He was 23.
I did everything I could. There are insurmountable amount of meetings I attended with counsellors, with nurses, with doctors, with inpatient psychologists about getting my son help, and the only response I got was, there aren't enough beds.
There aren't any beds. We kept hearing that. And what compounds it is that people with alcohol or drug dependencies often have mental health issues too.
It's extremely difficult.
Roger Brooking, Clinical Manager, ADAC, Alcohol and Drug Assessment and Counselling.
When someone has both an addiction and an underlying mental health problem, which is the case in about 70% of these situations, you refer them to mental health and they say, we can't treat this person until they stop drinking or taking drugs. You refer them to alcohol and drug treatment and they say, we can't fix this person until his mental health gets sorted out.
It's a lose-lose, and the pressure it creates can be expressed in a very simple number. What is your waiting list now?
Currently today ours is around 140.
140 people?
Yeah.
That's Claire Aiken, Program Director at Moana House in Dunedin. Roger Brooking recently asked her how long it would take to clear that waiting list.
And she said, well, I could read you the email, it says 8 years.
But what compounds that, and almost makes it a theoretical calculation, is that they don't have 8 years. I didn't know that until I asked Claire Aiken what would help Moana House. As a residential care facility with a 140-person waiting list, what do they want?
Goodness, that's a big question. Having contracts that were secure, that weren't up after a year.
Sorry, I just want to interrupt there. Your contracts are 12 months at a time.
Well, some of them are, and some are 3 years, and all our contracts are up on the June the 30th next year.
So an acclaimed and successful program with a waiting list years long only has a guaranteed future of 7 months.
And unfortunately, with many of the DHBs being in serious financial strife, then addiction services are the ones that get cut. So we've had no funding increase for 9 years from anybody.
So, long waiting lists, service providers that can do addiction or mental health issues, but not both, and the pressures of stretched and uncertain funding.
So, I'm generalising, but frequently what happens as a result is that people just fall through the cracks.
Roger Brooking. Natasha Sadler watched her son fall through the cracks, although it wasn't a fall is quick. Memphis, who'd been so bright and optimistic as a teenager, descended.
He really was an amazing young man. If you speak to anybody about him, they'll tell you how wonderfully soft-hearted he was. Great big laugh. But his mental illness took a toll on the last 4 years of his life.
And he was formally diagnosed with schizophrenia?
Yes, he had to have a slow-release injection 3 weekly of paliperidone, which is an antipsychotic drug.
Psychosis induced by schizophrenia and drug dependency to self-medicate the psychosis. Memphis had mental illness and drug addiction. The lose-lose.
For the past 3 years, whilst I've been living in this home, part of our day-to-day routine was helping to keep our boy well and alive.
But they needed help, and they couldn't get it. Not enough help to save Memphis. Which brings us back to the terrible point at which we started.
And I said, please admit him. We need some help. He needs, and he was asking too. He was at the meeting. He's saying, I can't stop. It's got me by the throat. The people selling the stuff know it's got us by the throat too, and they don't care, they just want the money. And he said, I need help. And what was the reply to both he and I? There aren't any beds. That's not good enough. Make some beds, find some beds. My son died. That's the ultimate cost to pay. Will you listen now? Will they listen now?
Natasha Sadler, speaking on Checkpoint last week. The new health minister heard her.
Yeah, I agree with Natasha Sadler that there's a real need to increase our capacity for addiction services.
David Clark. There's been much discussion of this, of course.
It did become an election issue. Mental health and addictions was front and centre because I think most New Zealanders accept that we are not doing well enough. We've had a 60% increase in people putting themselves forward for support with mental health and addictions over the past decade, and yet funding has gone up by less than half of that over that past decade.
And those who know it say it isn't even a pure saving because money not spent on addiction services does get spent elsewhere. Prisons. What is the correlation between drug and alcohol dependency and criminality? How often do people who end up in jail have drug or alcohol issues?
Well, everybody probably knows all the stats that have been done, and it's very high, often around 76%.
And in fact, there was a Northland judge about a month ago who said that 80% of the cases before him are alcohol and methamphetamine related, and if we actually had dealt with those problems, people like him would be made redundant.
Ross Bell from the Drug Foundation, who's talking about District Court Judge Greg Davis, who said in September that up to 90% of the cases he hears in Northland involve people with addiction issues. Ross Bell says that's just bad economics. We spend money on prisons after people offend, but we won't spend money on treatment to stop people offending.
We give resources to the police, and then we give resources to the courts, and ultimately we end up building more prisons. But we never put money early into the problem around health, into prevention, education, and into treatment, and we leave it so long. So if a person isn't getting help, then we let the problems get worse and worse and worse.
And Claire Aiken says it's even more revealing than that. Alcohol and drug addiction is often a response to something. It comes first less often than it follows something. In other words, it can be a clear message that something has already gone seriously wrong.
Often the difficult life and struggles within whānau have started before the drug and alcohol abuse has started.
Exactly as with Memphis, Natasha Sadler's son. The schizophrenia came first, the drug addiction followed. Everyone knew he was in serious trouble and no one could help.
The only response I got was, there aren't enough beds. That's not good enough. What it means is we just need money put there. Stop building prisons. Stop building prisons. Build places where you can get our people well.
Natasha Sadler spoke to us because she wants something to change. And while he's the new minister, and incoming governments do tend to make reassuring noises, David Clark says he's listening to Natasha Sadler and to people like Claire Aiken, Roger Brooking and Ross Bell, who all believe the costs of inadequate treatment, lives lost, families damaged, crimes committed, prisons built, are far greater than the costs of treating people at risk.
Look, I think with our mental health inquiry, which we're launching within our first 100 days, we'll get plenty of feedback on the quality or not of addiction services and the importance of making sure that they are adequate for the need which is growing in our community.
David Clark.